Assalamu alaikum doctors. In this video I am discussing a recall communications that is about developmental dysplasia of hip DDH. So the task is that you are talking to the mother of an 8-month-old baby who has a family history of hip dislocations. His checks were normal at birth and at 8 weeks. Okay, the mother noticed that the child's lower limb was not moving correctly and shorter than the other limb. X-ray of the hip showed features of hip dislocation (DDH). The task is that task is talk to the angry mother about the X-ray findings and the limitations of the screening for hip dislocation. So we draw the pictures. First, I am telling some spikes of this communication: introduce, break the bad news with empathy, apologize, reassure. Here to help DDH could be missed on screening. Okay, arrange meeting with the consultant and multidisciplinary team. We involve bone doctor, physiotherapist, occupational therapist. So bone doctor, physiotherapist, occupational therapist. Give the guidance regarding pulse if wish to complain. So as usual, we are starting with IRCAP. Can you please follow this drawing? When she has any idea about DDH, we tell that. Normally, our hip bone is forming of the two bones. Okay, normally our hip bone is forming of two bones, hip bone and the thigh bone. They are forming what we are called ball and sockets, where the socket is the hip bone and the ball is the head of the thigh bone. Okay, so hip bone and the thigh bone, and ball is the hip bone, and the thigh ball is the thigh bone, and hip bone is the socket. Normally, the socket is deep enough to contain and maintain the thigh bone in its place, and it become loose valve. This easily dislocatable. We will have an urgent meeting with our consultant and the bone doctor because it will need a surgery. Okay, why is not discovered early? Actually, we are doing a clinical screening test usually at third day and the 6 to 8 week. So third day and 8 week. Remember, third day and 8 week. We are searching for these conditions and whether it has any clicky hip or not. But RIA has no any click. Also, it called developmental. It may take some time to develop late. That's why we did not discover it at birth. Okay. So why did not do the jelly scan at birth? Normally, we are not offering a jelly scan to all babies. We offering the babies a clicky hip or if there is a family history of the same conditions or presented with his bottom or one of twins. But Ria was the second baby and coming with his head and out of any family history. So jelly scan normally we are not offering on every children who have clicky sound during hip screening. And what is hip screening we do at the third day and the 8 weeks. But and also some risk factor like firstborn, by bottom he is coming, and family history is positive, but Ria is coming by head and there is no any family history positive. And then mother is telling, my sister has the same conditions. I'm sorry for your sister, but this is not a first degree. Family history to be considered here is a sister or brother, father or mother. If I have another baby, will you do a gel scan for him? Sure, because here he will have a family history of the same conditions. She will complain, try to convince her. Then it's totally your right. I will guide you through the patient advice and liaison service. So that is about DDH communication. Thank you.